Now, officials believe that the Ebola outbreak began last month. The first known suspected case was a health worker who reported symptoms on April 24th. In early May, the WHO received alert of a deadly unknown illness. And last Friday, it confirmed it was the strain of the Bundibugyo virus of the Ebola virus. The WHO declared a global health emergency on Sunday. So that is the timeline. Dr. Nahid Bhadelia is a founding director of the Boston University Center on Emerging Infectious Diseases, and she joins us now from Boston. And I will say, well, grateful to have you given your experience. I mean, you believe this outbreak will get worse before it gets better. I'll point out you have worked on these kinds of outbreaks in Africa, and you say that the math is mathing here. Can you explain that?
Sorry, I meant to say the math is not mathing here, Paula.
Okay,
I
gotcha.
think what the general consensus is that we're not discovering the beginning of an outbreak. We're surfacing an outbreak that's been going on for a while. And I think even WHO and others have said that April 24th case is probably not the index case. Just the way that this virus spreads, the close contact that it requires, the fact that we're seeing so many cases and deaths already, the fact that you're seeing this in Uganda, in 2 or 3 other metropolitan areas, including Butembo and Goma in DRC at the border of Rwanda and in Bunia, it makes all of this very complicated in addition to the factors that your reporter just talked about: conflict in the area, remoteness, the fact that this is a near border with large refugee crisis and camps. I think all of that means that the response, we're already behind, and the number of resources that it would take to get ahead of it, it will take a while to get them on the ground to help DRC, despite their excellent experience and technical background in this.
Yeah, they've had so many challenges with this virus over the years. We do want to lean on your experience because you were a medical director of the Special Pathogens Unit at the Boston Medical Center. I will say again that it is a state-designated Ebola treatment center. So what needs to be now in terms of really trying to get ahead of this virus?
Yeah, Paula, my experience in the region, which is probably more attributable to what's happening right now, I actually took care of hundreds of patients, Ebola patients in West Africa during that large epidemic in 2014, 2015. And then I've worked on that border in Uganda near DRC and Rwanda as part of Ebola responses. And there's 2 big things in terms of bringing, in the absence of medical countermeasures and vaccines, 2 big things need to happen in addition to the risk communications and community engagement that Dr. Tedros talked about. First, you got to get everybody who's suspected, who could be confirmed, into care, because you don't want that person to potentially continue transmitting to others in the community. That means you need personal protective equipment, you need healthcare workers, you need diagnostic tests. And remember, already over 500 patients. We're struggling with a handful of hantavirus, folks that might have been exposed. Imagine a country like DRC dealing with that big a number of cases. Then you have to do contact tracing. So everybody that those sick patients came into contact with, you need to figure out how many those are and put them in quarantine so that if they develop symptoms in the community, they don't continue that chain of transmission. An average Ebola patient can have between 10 to 20 people that are their close contacts. You do the math, that's 10,000 people that need to be contact traced, and that's a lot of number of people that need to be working on the response, which currently the DRC does not have.
Yeah, and then again, we're back to the math. It can be daunting. We learned that during COVID. I'm wondering, I asked Larry, but I'll ask you as well, do you believe there may have been a systemic failure in surveillance here? And do you think the cuts currently to America's public health institutions had anything to do with this? I mean, you have so much more experience. I've been on the ground in countries all over the world where the CDC is right there alongside with us.
You're right, Paula. And I think the USAID cuts have hurt in 3 ways. First, 80% of the USAID global health budget was cut. So what we've seen is increases in malaria cases and cholera cases. So as someone who's taken care of Ebola patients before, I can tell you early Ebola presentation is like every other disease that's infectious in that area. So it's easy to miss, particularly when all the other endemic diseases, the numbers are up. The other thing that's complicated is that a recent study talks about the fact that areas where USAID aid was pulled that are dependent on it, conflict levels have gone up. And we've seen that in DRC, particularly with the M23 takeover of Goma, that big city at the border of Rwanda. And then lastly, exactly what you said, Paula, generally CDC and USAID are on the ground with partners coordinating already because they had that presence to begin with, and not having that presence right now will mean delay in ensuring that we're making sure this outbreak is under control.
Dr. Bhadelia, we really appreciate your expertise in this as we continue to monitor the situation. Thanks so much.